MaryClaire Dangel, you're the Chief Operating Officer of the Henry Ford West Bloomfield Hospital in Detroit.
That's correct.
What does that mean? What do you do all day?
Wow, it means that I'm responsible for operations of the hospital, day-to-day operations of the hospital.
Okay, so you're the manager on the floor, is that correct to say?
Probably more like I'm the manager over the hospital. Probably would be a good way to put it.
And the Henry Ford West Bloomfield Hospital is the most friendly hospital in the United States. How did you do that?
Wow, I would like to say that it is. And you know what? We opened the hospital about 4.5 years ago with a whole different philosophy on how we were going to treat our patients, our families, and each other. And we shared that vision day after day after day with our leaders and then our staff, and we address it every single day. So we share results with our team about how patients and families feel about us. We address issues that families and patients have in real time. Research will tell you that if you address a challenging experience before the patient or the family walks out of the hospital and you get it corrected, you'll have a customer for life. And that's really our goal. So we focus on our mission and our vision every single day in huddles and workshops and literature all over the hospital, and we just continue to educate our staff.
And in what way is it different from every hospital? What do you differently?
Wow. I think first of all, we set the bar up here. And
you have to jump high.
You have to jump high. We like to think maybe not jump so much, but just land there. And we educate people when we interview that we do it different. So we let them know, you're coming from a different institution. We do it different here. This is what we do. Is this something that you can do? Some people can't. And if they can't, then we usually don't bring them on. But the people that we do bring on have made that commitment that they are going to provide exceptional customer service and have service excellence. Be a servant staff member or a servant leader. You know, what can I do for you? I have time for you. What can I do to make your stay better? And so we make that part of our goals. Employees are graded on that. We make that part of our learning. We open up all of our meetings and all of our gatherings with patient stories. Most of them are good. Some of them give us room for opportunity to improve. But we keep it out there all the time.
You're in contact with everybody in hospital all the time. How many hours a day or days a week do you spend in the boardroom?
Wow. In the boardroom, we try to stay away from the boardroom because as leaders, that's not where we should be. Leaders need to be out. Leaders need to be walking and they need to be visible. Leaders are the ones that are the service excellence examples to their staff. If I can't do it as a leader, how can I expect my staff to do it? So I need to set the example. So how many hours a day do we stay in the boardroom? We try to stay out, we try to get out, we try to walk around. Now that's not always possible because there are responsibilities as leaders of a facility that you got to get your work done. But you know what? That's what the next level of managers are for, and then the supervisors, and then the team leaders. So you make sure that your leadership structure really buys into it and they spread your vision.
Okay. And then you park your car in the last place, on the furthest place in the parking. You push wheelchairs, you bring trays to the patients. Isn't your wage much too high to do such things?
How do you put a value? How do you put a price tag on getting a patient to their car faster? How do you put a price tag on the value of delivering a food tray while it's still warm? I don't think it's not something that I do 8 hours a day, but you know what? I think that we all need to look at our entire hospital and see where every moment there's a different need somewhere. And if I have the time, I need to address that need. So if I'm pushing trays or if I'm pushing patients or I'm directing people, that's what my job is as a leader, is to step in and help.
And it's a leadership by example?
Absolutely.
Could this be an advice for Dutch healthcare leaders who spend quite some time in their boardrooms?
Well, like I said in my lecture, I was told that as you move up the career ladder, you have less and less time to be with your people. And I think as leaders we need to rethink that, because our staff needs to see us. They need to have they need to be in touch with their leaders. So, like I said, we've all been given a wonderful leadership tool, and that's our feet. And our feet, we lead by, your feet are going to be your tool to get out there as a leader. Walk the halls, see your staff, let your staff see that you're walking from the last parking spot in the hospital. You don't need front row parking, right? Mm-hmm. You need to be out there with them. So I really encourage everyone to do it. It is amazing, the buy-in that you'll get from your team when they see that you're walking the talk.
So what does happen?
What just happened?
What does happen when they see you walk?
Well,
what's the reaction?
You get emails like I got last night that said, we haven't seen you in a whole week and we want to know where you are. And you make us feel good when you walk through the hallway. And so that's what happens. You get you feel a little guilty about taking a vacation, but it makes you feel like what you're trying to show people and deliver to people is what they want to see. They want to be a part of it. And they're looking to you to lead them.
What is the next step for your hospital?
Ooh, the next step for our hospital. We will probably, in the next 2 years or so, be expanding the hospital because we have paperwork that addresses a certificate of need, which is, in the next few years, we have to have shovels in the ground in order to build, based by government regulations. So that'll be a challenge to go from a 200-bed hospital to maybe a 300 or 350-bed hospital and still carry that mission forward. So that's kind of where we are. We're working on food. We're working with a government program now to provide healthier meals and reduce sugar and all kinds of stuff. So it's kind of like a moving target. So,
and you're working on a bigger scale in the future. Mm-hmm. What do you think about it? Is it possible to do it?
It is. I think that that old saying about you catch more flies with honey than you do with vinegar. If we walk into our hospital every day with that smile on our face, how can I serve you? How can I be of assistance to you? Patients are more compliant. They listen better to their instructions. They get out of the hospital sooner. The costs go down. They don't get readmitted because they've had a failure of their health at home. Yes, I think we have to. I think we have to. And in the United States, we have the potential for 30 million more people entering our healthcare system probably in the next year to year and a half. If we don't learn how to handle that influx of people, we're going to have some challenges. So it's so much nicer to provide service excellence.
Yeah, and then about the prevention, but that's a big customer base. 30 million people entering the healthcare system because they didn't live very healthy. They ate much food, unhealthy food. So a lot of things to do. I wish you good.
We have a lot of things to do. We have a lot of things to do. You know, in the United States, we don't necessarily look at wellness. In fact, wellness isn't usually paid for by insurance companies. Wellness care or just a wellness model, and we all know that it's cheaper to stay healthy. Yeah. So we have a lot of work to do on that end. So one step at a time, keep people healthy, good food, positive attitude, service excellence. It all rolls together.